Hantavirus is back in the news, but how does it actually spread? According to a 2023 review in the Lancet Infectious Diseases, hantaviruses are zoonotic viruses mainly linked to rodents. Humans usually get infected through exposure to infected rodents. But there is one important exception, and this virus. It has been documented to spread from person to person in Argentina and Chile, but this usually happens through close and prolonged contact. For example, in 2018 to 2019, a person-to-person transmission event in Argentina affected 34 patients, 11 of whom died. Data from Chile also showed that the risk was much higher among sex partners of a patient, around 17.6% compared with 1.2% for other household contacts. So the risk factors for this virus, person-to-person transmission, are mainly intimate contact, tongue kissing, or sleeping in the same room around the time when fever first begins. Hantavirus is also not just one disease, it is a group of viruses that can cause different types of illness. In Europe and Asia, the more common form is hemorrhagic fever with renal syndrome, or HFRS. In the Americas, the more common form is hantavirus cardiopulmonary syndrome, or HCPS, also called HPS, and some related viruses have case fatality rates between 30% and 45%. Although these diseases look different, they share one key mechanism. Hantaviruses increase vascular permeability, meaning fluid can leak out of blood vessels, leading to low blood pressure, kidney injury, pulmonary edema, or shock. That is why hantavirus is dangerous, because some severe cases can progress very quickly. Another problem is that early symptoms can be hard to recognize. At first, it can look like other febrile illness, including influenza. Common symptoms include fever, muscle pain, headache, and sometimes nausea or vomiting. So how can we reduce the risk? The key is to reduce contact with rodents and rodent-contaminated spaces. If you see rodent droppings or nasty materials, do not sweep them directly. Ventilate first, wet the area, wear gloves, clean carefully, and wash your hands. I'm currently in Toronto, and news reports said some contacts linked to this cruise ship event are self-isolating in Ontario and Quebec. But this does not mean we need to panic. Hantavirus is not the kind of respiratory virus that spreads rapidly through the general public, and it is not a typical fecal oral infection. That is also why WHO currently assesses the public health risk from this cruise ship event as low.